Hi, this is Tanishka and this is my journey through scoliosis and spinal fusion surgery. I was diagnosed with scoliosis around 4 years back when I was in my 8th grade. So we visited a few doctors who back then recommended me to go through the spinal fusion surgery. At that time, we didn't really know what scoliosis was, and so we decided to avoid going through the surgery. So we took to different methods like bracing and exercise. Wearing the brace every day at home and at school was very uncomfortable, because of which I couldn't focus on my studies. Even after a few months, my hump still kept on growing with my curve, which just demotivated me to wear the brace, and because of which I also lost my confidence in myself and my posture.
So Tanishka to me was like any other normal girl. She was well-read, very active. Her issue was that she had a hump in the back, which was what was bothering her. Now this hump in the back was because her spine was not straight. It was a little curved. And this thing is what is scoliosis. So scoliosis is not a disease. It is basically an anomaly in the growth of your body, in which your spine, instead of growing straight, becomes curved. So a spine has got an upper part and a lower part. The upper part is the neck and the upper back area. The lower part is the lower back area. Suppose the upper part starts growing in a curved way. What will happen is eventually the body starts tilting in a particular direction. In such a situation, body has to take a lot of efforts to keep it straight. This is not compatible with a normal life, and these patients eventually have a lot of problems like breathing difficulties, lower back pain, hip pain, knee pain, not able to walk properly. And this is something that they experience not in the 20s and 30s, but later on in life in 40s and 50s.
Around last year, my back started paining a lot and I couldn't take it anymore. That's when I decided to go for the surgery. I told my parents. They were reluctant at first, but eventually they agreed.
Now in her case, she had a S-shaped curve in the spine. So her spinal cord was also S-shaped. What happens is when we start correcting the scoliosis, at that time these nerves could undergo shock because they have been living in this particular way for around 15-16 years of her life. So when we suddenly correct it, it can go into a state of shock, and this can cause weakness in the limbs, which is the biggest concern for the patient and the doctor. So the other concern that Tanishka and her parents had was her life after the surgery. Will she be like any other normal girl? And to this my answer is of course. There is no reason for being restricted. The advances that have happened in this kind of surgery are so much that almost all these patients live an absolutely normal life. Correcting the deformity is not the primary target of the surgery. The primary target of the surgery is to halt the progression of the deformity so that she grows with a normal back. But with the advances in technology today, we are able to correct that deformity without causing any harm to her.
I visited a few doctors, and when I met Dr. Priyank Patel, I knew he was the one who was going to perform the surgery on me. The way he explained things to me just made me feel more comfortable to go through the surgery. Within 2 weeks, all the preparations for my surgery were done and I was ready to go through. I was admitted to the hospital the day prior to the surgery. I was nervous at first, but all the nurses and the doctors comforted me really well.
We were able to correct the curve and give her a relatively straight back.
The first few days were very tough, but the support that I had from my family, from the doctors, from the nurses kept me going. After a month I was well, I could give online exams, and about after 2-3 months, I was able to dance and I was back to my normal routine. Looking back, going through the surgery was the best decision in my life.
So it's a complete misconception that your life gets restricted after the surgery, and who better to tell you about this than Tanishka herself.